Well, welcome back from that. We hope you enjoyed that. Now you know what's coming up on the show. We're going to talk about taboos, as we said.
We're moving on to a sensational topic, something that the first blast...
Yeah.
Okay. But
well,
you know...
It's sensational because it affects people all over the world.
And it's sensational because it's not been talked about in a forum like this before.
And now we have Dr. Sadaqat Ali, who's joined us all the way from Lahore to discuss this topic today.
Welcome to the set, Dr. Sadaqat. How do you like our new set?
It's beautiful.
Thank you.
I'm a keen observer of Dawn TV, and this is absolutely fine.
Is this the best set on Dawn?
This is the best.
All right.
Oh, I think it is.
All right. Sir, you've flown in from Lahore, which means that you're stationed in Lahore, and but you were talking about your hospitals. Where are they?
No, basically I'm stationed in Lahore, Karachi and Islamabad, and I'm flying around this triangle all the time.
All right. And your hospitals are also...
And my hospitals are in all 3 cities of Pakistan.
For the sake of the audience out there, we had Dr. Sadaqat with us when we did the drug addiction show. Dr. Sadaqat happens to be the expert on addictions and related issues with it.
Yeah.
In that regard, because we had so much feedback, and thank you for writing in to us, we decided to call you over.
I'm pleased to know that. And thank you for having me on the show again.
Thank you for joining us on the First Blast again. And of course, because your whole field, the field that you deal with basically is addiction, and this is an addiction too. It's a disease, it's an illness. Tell us, what is this disorder, this disease, this illness called alcoholism? What is it?
Contrary to the popular belief, it is a physical disorder like diabetes. It is most closely resembling diabetes and heart disease, whereby metabolic disorder starts this process of alcoholism. And people who drink alcohol do not necessarily become alcoholic one day. Only 10% out of those people who have a genetic code in this respect ultimately cross that invisible line and fall into alcoholism.
Dr. Sadaqat, your field is primarily addiction, and this is addiction again. Alcoholism is a kind of addiction, or is it? What is this disorder, this illness, alcoholism?
Contrary to the popular belief, it is a physical disorder most closely like diabetes and heart disease. The actual problem is metabolic in nature, and this metabolic error starts in the body, not in the mind.
So it's physiological?
It's physiological to begin with, but ultimately it encroaches the psychology and the social life of the person who suffers from alcoholism. Everybody who drinks does not end up as an alcoholic. Only 10% of those will cross that invisible line into alcoholism, and it's a nightmare.
What makes you more susceptible to actually becoming an alcoholic?
It is a genetic code, basically. There are a lot of triggers in the environment also. There is a psychological problem also, but the real trigger comes from the genetic code, and once that genetic code is triggered, it is never reversible. It goes on.
Irreversible.
It is irreversible.
And the only way to stop it then is just to stop.
Can you explain genetic code for the audience out there? What does it imply?
Basically, the seat of drinking is in the mind, but the seat of alcoholism is in the body. If somebody starts taking alcohol in teenage or early in life, then there are more chances of that genetic code to be triggered. But if somebody starts alcohol late in life, then probably there are less chances of that person to become alcoholic.
Well, presumably just less time in a lifespan. The later you start anything, the less time you have for it to take effect on you.
No, genetics is like that. If there is a genetic code and you trigger it earlier, it is going to be severe.
What are some of the triggers that get people to drink alcohol to begin with? I mean, social, yes. You know, people go to bars, or they go to pubs, or they go wherever. I mean, there's a whole social element to this. But aside from that obvious one, what would be other reasons why, or triggers why someone might imbibe alcohol?
The real thing comes from the genetics. But if there is a genetic code, and there are environmental factors also very rich towards that, then definitely the person is going to suffer from alcoholism.
So there's a clear difference between people who are alcoholics and people who like to have a drink or two.
Absolutely. If somebody drinks a drink or two, and if it is not a problem, then it is not a problem. But if the drinking starts generating problems, then definitely it is a journey towards alcoholism.
All right.
If you have an alcohol addiction, And there are, as you said, 10% of people who imbibe alcohol do become alcoholics because of their genetic mapping. What kind of taboos, societal taboos or social taboos, would stop someone or hinder someone in the recovery process?
The first part of your question is towards society's impression of drinking more than desirable. If society looks at somebody who is drinking in an alcoholic fashion, the society does not know that he is suffering from a physiological disease. Society looks at him as a person who has very weak will, who is evil and wicked. So there are hardly any chances of help for him like a sick person. He will be always looked at a person who is creating problem. The second part of your question is, why is he not getting help? The answer to this question is that the hallmark of alcoholism is denial. By very nature of this disease, he cannot look at what is happening to him. This is something very, very serious, because this person is suffering from alcoholism and he is under the influence of a toxin which is chloroform-like. Like in normal people, when somebody drinks, the ultimate end products of alcohol are water and carbon dioxide, and these are two harmless products, and ultimately they are eliminated from the body as such. But if somebody is suffering from alcoholism, he is not producing carbon dioxide and water, he is producing a very, very toxic substance which is aldehyde. It is closely resembling the chloroform. So if somebody is accumulating chloroform while he is drinking more and more, and ultimately he may pass out also, then you don't expect from him that he will look at him. Normally people cannot look at themselves,
anyway.
But if somebody is suffering from alcoholism, he can definitely not look at him, and the consequences his drinking is generating.
This is very interesting, that what you're saying is that I mean, seriously, I thought that it was all in the mind, that they're in denial, but it's because of the physiological aspect. By physiological, we mean that he's actually on chloroform as such.
It's chloroform poisoning.
Well, you know, just like you would not be able to function and to be able to understand whatever's going on around you, of course you're going to be in denial.
It is a mindset which leads somebody to drink, but it is the body which creates trouble, and there is a metabolic disorder, and it is the body which is vulnerable, it is not the mind. So the seat of alcoholism is in the body, and the seat of drinking is in the mind.
I think this is a very clear distinction, which I think for a lot of families who have alcoholics, that they've had to deal with alcoholics in the family, have had to deal with alcoholism as a disease. I think this is a distinction that people need to know. I think they generalize and they think that anyone who has a drink is by default alcoholic, number one, which is wrong, and anyone who's an alcoholic has somehow lost their mind and has control over it, which they don't. Beyond a certain point,
if somebody is under the influence of alcohol most of the time, and his alcohol drinking is generating chloroform like toxic substance in the body, and the toxic substance is circulating in the body all the time, sometime the body tries to wash it out and the person is passed out, and the body does this lot of restorative work. The body is working overtime. That is why the liver is involved.
Yes.
What is the disease model of alcoholism? What is the format it follows?
Yes,
what can you expect? How do you recognize, say, stage 1 of alcoholism or stage 2? Are there stages? Are there phases? How do you pick up on it? How would you know? Not just the patient, but the surrounding family as well. What are the indicators?
I have described the disease model already, a part of it, but if somebody starts producing a toxic substance which is like chloroform.
So they need a blood test or urine test or what?
There can be a blood test.
Blood test.
Because there are ketones present in the blood, like you have ketones in a severe kind of diabetes as well, and there is a differential diagnosis of diabetes, coma, and a person who has passed out because of alcoholism. And once this disease starts, then it is progressive. It is primary. Primary means that it has genetic content, basically it is primary, and then it is progressive. It is going to progress, and if untreated, it is going to be fatal.
Sir, I'm sorry, we'll have to cut you short there. We'll have to go on a break. However, after the break, we'll be coming back and discussing more intervention and more treatment-related aspects of alcoholism. Please don't go anywhere. We'll be right back.